Hi everyone, we are talking about measles today. Measles is caused by the measles virus, a single-stranded negative sense enveloped RNA virus. Measles is highly contagious infection. Measles is an airborne disease which spreads easily through the coughs and sneezes of those infected. Any contact with an infected person can cause infection. People are infectious to others from 4 days before to 4 days after the start of the rash. People who recover from measles are immune for the rest of their lives. And brief history. Uh, Licensed vaccines to prevent the disease became available in 1936 and an improved one in 1968.
Hi everyone. One day when I came home from school, I got rather high fever. After 2 days I started to cough and my eyes were quite painful. First I thought that I'd got cold, but 2 days later a red itching rash emerged.
The classic signs and symptoms of measles include 4-day fevers and 3 Cs, along with rashes. Symptoms usually develop 10 to 12 days after exposure to an infected person and last 7 to 10 days. Fever is common and typically lasts for about 1 week and is often as high as 20 to 40 degrees. 2 or 3 days after the start of symptoms, small white spots may form inside the mouth, known as Koplik spots. A red flat rash, which usually starts on the face and then spreads to the rest of the body, typically begins 2 to 5 days after the start of symptoms and lasts up to 8 days. It starts on the back of the ears and after a few hours spreads on the head and neck before spreading to cover most of the body, often causing itching.
When I went to the doctor, it turned out that I have measles. Doctor told me to stay home, rest and eat properly.
Clinical diagnosis of measles requires a history of fever and at least 3 days with at least one of the 3 Cs. Laboratory diagnosis of measles can be done with confirmation of positive measles, IgM antibodies in blood, or isolations of measles virus RNA from respiratory specimens. Slavia can be controlled for salivary measles specific IgA testing. No specific treatment is available, and supportive care may improve outcomes. This may include giving oral rehydration solution, healthy food, and medications to control the fever. Antibiotics may be used if a secondary bacterial infection, such as pneumonia, occurs. Vitamin A supplementation is also recommended in the developing world. All other treatment addresses symptoms with ibuprofen or paracetamol to reduce fever and pain, and if required, a fast-acting medication to dilate the airways for cough.
I was at home for 3 weeks. Now I'm healthy and able to go to school again.
Patients who become sicker may be developing medical complications. Some people will develop pneumonia. Other complications include ear infections, bronchitis, brain inflammation, encephalitis, diarrhea, blindness, and coronal ulceration. Complications are usually more severe in adults who catch the virus. Risk factors of the complications may be malnutrition, underlying immunodeficiency, pregnancy, vitamin A deficiency, low per capita incomes, weak health infrastructures. Prevention, the measles vaccine, safe, effective, and inexpensive. Uh, and it has to be done in 2 doses because 50% fail to develop immunity from the first dose.
And here you can see the measles cases in September 2013 to February 2014 all over the world. Thank you for listening.